welcome everyone. If you would not mind, just a brief introduction for our audience.
Yeah, I'll get started. Melissa Nunez. I'm here from CuraLinc. I am a licensed clinical social worker. I am the VP of Operations at CuraLinc. We provide EAP and wellbeing services. I've been in the industry for about 18 years now. Coming from Chicago, very excited to be here. We're a big sports city, so excited to see your city celebrating the Knicks today.
Good morning, everybody. It's on? Good. I'm Chris Mosunic, our Chief Clinical Officer at COM. I am from New York, so this is a great day. I'm 53 years old. Probably going to be the last time, so I'm going to bolt out of here and catch the parade after I can, but after this talk. But the important thing that we're going to talk about today, mental health, is essentially something that we want to deliver to everybody and be able to do it at scale. So we're going to hit on those themes today.
Great, congrats. Jay Meyers, I am not...
At being 53?
Yes,
Yeah.
I'm 53. It's the first championship, so I know, as a Bulls fan, I know what it feels like to finally get over the hump. So. Oh, come on. I feel like we're helping you all because we're so bad. I'm Jay Meyers. I'm the Chief Commercial Officer, so I'm not a clinician, but I am a consumer, so I use mental health regularly. I'm happy to admit that. And I'm with Rula Health. We're a provider group enabled by technology, so we're thrilled to be here.
Great. And I am excited to actually moderate this panel. For those of you who know me, and for those of you who don't know me, this is a topic that I am extremely passionate about, again, personally, but also professionally, and the fact that this is so important at Brown Brothers, and I'm sure for most of you in your workplaces. So let's jump in to our questions, and let's start with access. We say that access has expanded, but people still aren't getting access to care. Ghost networks, long waits, confusing entry points, and some groups are still getting left behind more than others. Where is it actually breaking down, and what have you seen that reliably gets someone into the right care within a week without spending more? So Jay, I want to send that over to you.
Yeah, I think over the last 5 or 6 years, access has really improved, but there's still a question of complex benefits, finding out if your provider is in network, and then what are your cost share. And I think that's what employees, people, patients, whatever we choose to call them, are really looking for. And I think that can be solved with partnerships with health plans, with employers, to figure out how to promote quick access. And so there's a couple of organizations out there that I think are helping to solve access. I think the point when you get past access is, are they in network? Can I use my insurance? Am I finding a quality provider who can suit what I'm looking for and help me deal with my needs and my issues, and then actually graduate? There's a lot of discussion about increased outpatient utilization. I believe that that's a good thing. I think lower cost outpatient therapy, psychiatric services are really valuable and can actually drive total cost of care. There's some studies out there that show that. But you've got to find the right provider, and I think that's the most important thing. And in this day and age with consumers using Amazon, we've got to make sure that your employees are aware that they have access to something like this. And there's Rula, there's others out there that are raising the bar for quality and making it easier so that you can confirm that your provider is in network and you know what your cost share is.
And the right provider is not always the first provider.
Correct.
That's
correct.
I think you almost have to give people permission to know that.
Well, and as somebody who's
navigating.
Right, and as somebody who's done this, for years and tried to find providers for myself, for my family, going to a payer directory or looking at my EAP and going through, before you could book and schedule in real time, it was brutal, picking up the phone and calling. And we see, the data shows that just by booking an appointment with somebody you feel is going to help you can overall reduce your total cost of care over time. And I just think between, partnering and having an EAP and having an in-network solution that will solve and enable people to quickly get to care is really valuable. And I think we're starting to see it, but it's about how we present that to an employer or an employee so that they can make it happen.
Melissa, thoughts?
Yeah, I'll just add, it's really about making sure the program you have in place is working the way you expect it. So at CuraLinc, we've really built our model to focus on, of course, easy access, guided support, resilient-based care, and verified outcomes. So easy access means being able to pick up the phone or go online at 9 o'clock or 11 p.m. Again, really having that choice to really be able to tap in, employers be able to tap in when they need that support, guided support. As Jay mentioned, sometimes it's not always to navigate, so having someone in your corner to help you figure out what's going to be the right fit, and ensuring that you're connected with the provider and working on that match, because again, we know that if you have a good fit with that provider, you're going to most likely continue, and overall your outcomes are going to be better. And really the focus, our foundation is resilience-based care, which is working on resolving the issue, working on providing skills and tools and techniques to be able to really grow capacity and be able to move forward once you've completed sessions, and to see that there's been improvements and you've been able to resolve your issue. And then outcomes, again, showing that there has been some improvements with validated clinical tools. So I think those things are really important to ensure a very seamless experience and need to be prioritized.
We're going to put a pin in outcomes.
Yes.
Okay. Don't steal your thunder.
Sorry, I got excited.
Don't steal your thunder. Okay. Employees are bouncing between apps, EAPs, therapy, psychiatry. What's the simplest way to get people to the right level of care up front? And do nudges and smart defaults actually work? Chris, what's your thoughts on that?
So smart science, behavioral science, for getting people into mental health treatment has been around for some time, and it works if people even know about the app. So the more important thing is still understanding, how do people even find out about yet another benefit? And that's the biggest hurdle that any organization has to overcome. So the one thing that I inherited at COM, I've been with COM now for 5 years, is a brand. We have a brand in mental health, and I stand on the shoulder of giants who built that brand. And the reason I came into COM, because they asked me to at first, and I said, heck no, I'm a psychologist. I don't want to go to COM. You guys are meditation people and wellness people. And they asked me to say, they said, well, can you bring us into mental health? And I said no. But then I thought about it overnight, and I'm like, wait, that's a brand that people recognize. So very quickly, I said yes, because being able to come into a mental health brand was something that didn't exist, and we were building it. So people who come in recognize the COM name. 1 or 2 people in this room know it, and because they also know it as an $80 app that they get for free with their benefits now, people fly in. So being able to come in with a brand is that people appreciate, respect, enjoy, and consistently delivers with actors you all love, like Matthew McConaughey. Like a lot of the people in this room will love Matthew McConaughey. Other ones will hate him. They can't stand his voice, right? And that's okay. That's what acting is about. So being able to have that engagement once the person comes in, and then being able to deliver on it consistently and actually say, we help you with your meditation, we help you with your sleep, we help you with your mental health, and people actually getting to those outcomes. And again, I won't steal the thunder on that, but you have a responsibility when people come into an app like ours to be able to get people to the right place, right? And I will tell you, an app is wonderful, but if you have moderate to severe mental health related issues, you don't want to be in our app. Maybe it could help a little tiny bit if you're moderate or above, but being able to triage and trusting the triage, because a big part of what happens when you triage patients is that they don't trust the triage, and they trust us. Again, I didn't build that. That's something we earned before myself, but continue to triage to the right provider organizations. That's something we take pride in.
Yeah. Read. Melissa?
Yeah, and I'll just add to that as far as, cross benefits, making sure that there's awareness and there's bridges across benefits. Because again, one thing is knowing there's a benefit that exists, but falling into potentially the wrong benefit. And if that benefit knows there's the right benefit, it's important that they're able to support, again, getting that member back to the most appropriate care. And then really just having access again to that clinician to help with the triage and help understanding what is going to be the solution. There's not a one fit all solution, and I think that's again really important when understanding it doesn't always have to be going to sessions. It could potentially be resources, support. It can be an online module, an online app and activity. So having that understanding, I think, is really important. And then just as far as the nudges piece, I do think that they do work in regards to reminding people they have a benefit and potentially bringing information to the surface before someone is kind of buried and looking for it within a platform or an app. So that is helpful, but I think there has to always be that human component. So it has to be both. Real, programs that are very successful have both components, and you know how to access them, and it's easy.
We like magnets, but you have to have stainless steel.
Yes.
If you send magnets home. Anyway, okay. Back to outcomes versus utilization. Behavioral health spend keeps climbing. What's the litmus test for knowing you're paying for better outcomes? Not just more therapy sessions? And how should that show up in a contract? Melissa, you want to take that one? And before you answer that, and I'm not part of the answer here, but in the description of the session, it talks about what employers should demand. So I'm an employer, so this is an audible for me right now. If that's okay, Janera, I'm going to do that, okay? Can I do that? Okay, good. So for any of my vendors that are in the audience, you guys know me as someone who's demanding, but I love hard. One of the issues I have as a client is outcomes, and that's based on members completing questionnaires, which is typically very low. So the measurement is like that. Yeah. Okay, I'm done.
No, I understand. And,
okay.
So I think that's why we have the industry kind of has focused on more of utilization defining value, but more sessions, more calls, and more, interactions. It's about the benefit being used. It's not showing the improvements that someone's getting better, as you said. And so really the question every employer should be asking is, can you show me the people who are using this actual benefit and who actually improve? So not looking at satisfaction scores or surveys, not how many sessions they attended, because again, that does not equal improvement. That doesn't equal resolution. That doesn't equal if they built the skills. So again, it doesn't show you clearly the outcomes. So really when we look at outcomes, and CuraLinc has done an entire peer-validated EAP study on outcomes and the process, and really needing to use validated tools at the beginning and then at the end, and ensuring that you're reconnecting to get those questions answered. And that's how you know if improvements are being made,
right,
using those validated tools. But if that circle is not happening, then you don't have those answers.
Yeah. And to add to that, a lot of people don't even know who Rula is, as an example. And as a provider group, we are talking with plans and employers about how can you contract for outcomes. So the good news is, as a provider group, we're in network, 180 million lives. We're a part of EAP network, so there's no additional cost to it. And we are driving that aligned incentive. So we'll say to a health plan, if you're with whatever your carrier is, for a certain diagnosis, et cetera, what's the right amount of time to be in care? Because there are studies out there that if you're in care too long for certain conditions, it's just not healthy. And that's also translates into utilization. And so the question becomes, how do you align your incentives across the board? How do you get people great access, high quality care? how does that care get paid for through EAP, where it's a covered benefit, and then through their medical, where they can transition. And then ultimately, how do you show outcomes? And being on a provider group, one EHR, clinical guidelines, we report on that all the time. And so it's great to be able to see some of that data, to be able to get back to the employers. It's like, hey, here's what your mental health benefit is paying for. Here's how it impacts ER, high cost claims, et cetera.
We have a perverse system with mental health. It's the way it goes with the payment model. Utilization is incentivized because more sessions equals more dollars. And until we fix that, we're going to have that problem. Mm-hmm. Having outcomes collected is easier said than done. When you have outcomes, you have to be able to have outcomes that, one, translate into an actuarial table to actually let the organization look at those outcomes. Mm-hmm. So you can have the best psychological questionnaires in the world, but they don't mean anything to a health plan because they know how to work with PHQs and GADs. And to your point, Sandi, before, PHQs and GADs, when you have a therapy network, right, what ends up happening is the patient essentially takes the PHQ and GAD at the beginning, and then the therapist has to chase down the patient to answer it again because they hate answering the PHQ and GAD every single month, which is what we want to have happen. So the answer becomes, how do you make taking the PHQ and GAD more appealing? Mm-hmm. And being able to have the old behavioral science nudges, okay, take it here, take it there, they don't work nearly as well as having a beautiful face on a screen asking you questions. It's the way we work as human beings. If we see a face, we respond. A big part of our brain actually locks into a human face, and we actually, even if it's an image or a movie, we connect. And when you do it well, you get rates of 80%, 90% GAD PHQ completions over time. And being able to have that built into the experience and then being able to export that data to the organization so they could see it themselves. Because I think a big part of what happens with mental health is the data gets massaged when you pass it off to the employer versus look on the dashboard of what's happening with your employee and it's intuitive what's going on with the outcomes and we don't intervene, you do it yourself. And that's the way to promote trust and keep the application, keep the apps out of the discussion and having the data just drive the discussion that the people can present themselves to their teams. Yeah.
Love that. I'm going to come back to that. We have 5 minutes. We can talk about this all day. I want to just get to this next question because this piqued my interest, and this is the part of this is audience participation time. By a show of hands, how many employers have 4 to 6 vendors in the behavioral health space? Can I see a show of hands? 4 to 6. Hi, please. I see 2, 3, 4. Jared, up. I can't see. Up 4. How many? I think there are. I don't know. Okay.
Yeah.
So here's the question. Most employers now have 4 to 6 vendors in the behavioral health space. Tracy, I said, we don't. We have 1 plus behavioral health in our medical plan. Okay, what does good governance actually look like, and where do managers of people fit? What, this is interesting. What should we realistically expect them to do to spot issues early and get people into care without burning them out or creating risk? This is everybody.
Mm-hmm.
I can start.
Okay, Chris, go.
Because the people who raise their hand with 4 to 6,
yeah.
Yay. The reason being is you're really trying to take care of your employees. It's just really expensive to do that. Mm-hmm. So the governance model that we employed was being provider agnostic right from the beginning, right? There's never going to be one size fits all, one company, one full stack dream that, this solution is the only one you need for mental health. It's just not the way the world works. The same way it doesn't work with a health plan.
I stretched myself to think about pediatric, remember?
Right.
I'm like, okay, that makes it 2.
Yeah, right.
Okay.
Yeah, so like a Bend Health was an amazing organization and Lyra acquired them to try and move in that direction. But the way to go is essentially being responsible about triaging patients to the benefits that the employer wants them to. That's the way we see it. And being able to scale is the reason we've been able to scale with health plans the way we have is essentially because we're provider agnostic and just being responsible with the triage versus having preferred partnerships.
And then I just want to add it to the manager piece. So many times managers are kind of have the first opportunity for early intervention, really, because they're able to notice patterns of decline or notice absenteeism or notice something is not quite right. But what is important is that managers are given training on how to have conversations with employees as far as not just awareness of the programs, but being able to say, hey, there's support. I noticed some things going on with you, and this is how you can connect. So having that confidence and knowledge, not to take on someone's issues or become the clinician themselves, but again, knowing their role as far as early intervention to be able to have a frank conversation and say, hey, I've noticed you've been down, or I've noticed these things, and this is the program that can help you. This is how you can connect, and this is what they can do. So ensuring that they have the training and knowledge that they can feel confident because they're frontline with the employees, that potentially they have an opportunity for that early intervention.
I mean, I couldn't agree with you more. I think making it super simple for people to access high quality care, I mean, we all want that. Mm-hmm. And so, you know, between the three of us, four of us, there's a lot of different opportunities. And I think if you know, as a manager, as a benefits leader, if the ability to have a solution that's super simple and straightforward that covers 85%, that's in network for the two main things you're paying for, EAP and your medical coverage, you know, there's a lot of value there. And that's our business model. As a provider group, we're in network with both. And the goal is if you need therapy or medication management or psychiatric care, great. And I think that's the point. Like, keep it simple, keep it straightforward, you know, leverage the benefits you have, and identify what's considered quality. And I think that's the other hard part. We talked about this at the beginning, and we're kind of ending on that, you know, how to determine quality. And I think we're at the stage now where we as an industry know what a quality outcome looks like for the most part. And it's the responsibility to ask as an employer who's paying for the benefit. You know, we at Rula as a provider group and the others, you know, we're all about delivering a quality resolution because it's a benefit to everyone.
And let us define the quality versus a manager having the responsibility of having to determine what a good benefit is for the patient and explain to their employees, because that's a mess, an HR mess right there. So allowing, when you go into a service, one of the vendors, make sure the vendor is explaining what quality is and how they're delivering it, so you don't have to do it as a manager.
Yes.
That's great. Yeah. I think we are at time. So I want to thank everyone for, I think, a great conversation, sharing your thoughts. I hope this was beneficial for everybody. So thank you.
Thank you.
Thanks.